Hey, everybody. Welcome to Counterpoint. I am here today with Dr. Tanya Paynter. And today we want to talk about something that can be going on under the surface for people with migraine that they may not even necessarily know is there. So we really want to bring some awareness to this issue and point people in the direction of resources. I am talking about PTSD. Now, I think that we have a tendency to think of PTSD as something that happens to soldiers and something that doesn't necessarily impact the lives of regular people. But there's some pretty astonishing statistics on the role of PTSD in migraine that I'd like to share with you. And I think the most important statistic is that about a third of people with chronic headaches actually meet the diagnostic criteria for PTSD. That seems like a lot for me. I'm very used to looking for things like anxiety and depression in people with chronic headaches, but I will be honest, I typically don't look for PTSD, but after diving deeper into some of this research, I'm going to start doing that. So, Dr. P, what is your experience with this issue?
Yeah, this is something that I was shocked by some of the statistics that you gave on PTSD itself. But prior to hearing that, I have seen quite a large correlation between people with chronic migraine, chronic headaches, and past traumas, usually childhood, but sometimes as a college student or a young adult. And so it's something that I actually addressed when I built my migraine program. We talk about this piece because our emotions that we've stored for our entire lives can play a huge role. And I actually have a couple of statistics myself, if you'd care for me to share them really quickly on abuses and such.
Yeah, absolutely.
So I came across this study, well, actually multiple studies that were quoted here on, let's see, where did I find this actually? The Institute for Chronic Pain. And I'm quoting here, upwards of 90% of women with fibromyalgia syndrome report trauma in either their childhood or adulthood, and 60% of those with arthritis. Let me skip ahead to the headache. So 66% of women with chronic headache report a past history of physical or sexual abuse. Among men and women, 58% of those with migraines report histories of childhood physical or sexual abuse or neglect. So even if they weren't technically meeting the criteria for PTSD, which is, obviously going to be a little bit higher, this is still huge, 66%. That's 2/3. And a third of, half of those are diagnosable with PTSD. So I think this is a huge issue. That maybe isn't even acknowledged by the person themselves.
Yes. And I think you bring up a really great point that I think because people aren't aware of the diagnostic criteria, they may not know that the symptoms they're having can be attributable to PTSD. And one of the things that's important is you don't necessarily have to have been the victim of the traumatic event. You can have PTSD if you witnessed a traumatic event. So, for example, if you were in a car accident in childhood and somebody else got hurt, if you saw something or heard something happening to somebody else, those are still things that can cause PTSD. So the key thing is it has to be a significant event that induced a strong emotional response in you at the time. So you can imagine this happens a lot to us when we're kids. We see things, events happen in our world. And of course, when we're children, we are very much more emotional. And so it's pretty easy to have something there in the backdrop that caused a strong emotional reaction for you when you were a kid. So I think that's probably the most important thing to clarify is you don't necessarily have to have had some kind of a trauma that happened to you personally. It can be something that you witnessed.
Mm-hmm. Yeah. And I think that is a very important thing to mention because, even something as, well, an example that I'll use that I've actually had a patient have happen to them is when they were younger, I think they were in their either like tweens or somewhere around there, 10, 11, 12. and they witnessed a friend get hit by a car on their bike.
Oh,
And, it nothing happened to them. They weren't hurt. The friend ended up living, but that thing that happened was so traumatic for her that she was still, as an adult, it was causing her physical symptoms as a result. So, you might not even be able to think of an incident that happened to you that would have been traumatic like that. But if you think about things that you may have witnessed, as you said, Dr. B, it can be something like that, oh, it ended up being okay, no big deal. Like, my friend got hit by a car, but it was fine. She went to the hospital for a couple of days and then came back out. But just seeing it and your body's response in that fight or flight moment, that can be it, right? That can be it. So.
yeah. Yeah, and I think that's a really good point, that one of the key features of PTSD is that you keep remembering it. So if there's something significant that caused a strong emotional reaction in you, fear, horror, helplessness when you were a child, and you still remember it, you are probably re-experiencing it, right?
And conversely, it could also be that you have forgotten it. It can also be that you've completely blanked it out of your mind. And that was something else that I've seen before, is someone who, there was something there, I could tell. And so we just really did a lot of counseling through our sessions. And eventually she came back and she's like, I know what it was. This happened, and I totally didn't even remember that this had happened to me until we started digging. So it can be something that you've blocked out.
Yeah, something that you've blocked out, I think, is where you were going with that. Exactly. And another feature of PTSD is that we tend to have an avoidance and a numbing. So I think what was happening for your student is a numbing experience, kind of an avoidance. This can also manifest as, for example, not wanting to drive. If, for example, you were in a significant car accident as a child, maybe you just avoid driving. You don't like it. You always have somebody else drive for you. If there was a place where a traumatic event happened, you don't want to go back there. You go around the block to not drive down that block. That kind of thing. The avoidance and the numbing can be a significant factor there. So we've got three sort of surprising features related to the diagnosis of PTSD. Number one, it can be an event that you witnessed, not necessarily something that you were the victim of, but it has to have provoked a strong reaction in you at the time. Number two, it's something that you remember, something that you relive. Maybe it is thoughts about it, intrusive thoughts about it. You're trying to do one thing and you're thinking about the traumatic event. It could be something where you're having nightmares about the event. That can happen too. So that's another way of having intrusive thoughts. And then the third feature is that it often provokes this numbing or avoidance. So, you may avoid where the trauma happened. You may have a sense of numbing. I think this happens a lot, particularly in women who have had sexual abuse in their past. Obviously, sexual abuse and physical abuse is much more common in women than men. And there can be sort of a decreased capacity to love, a sort of shutting off of feelings of intimacy that can significantly impact your life. So I think those are three very interesting features about the diagnosis of PTSD that maybe not everybody even knows. And just another feature that we see fairly common in people who have PTSD is what we call hyperarousal. And that means difficulty sleeping, difficulty concentrating, an exaggerated startle response. And I'm just curious, now that I am looking at it through this lens, I feel like I see this in a lot of people. Dr. P, I'm curious, would you say that those are features you see in a lot of your migraine patients, this sort of hypervigilance with difficulty sleeping or exaggerated startle response?
Absolutely. And it's always something that you attribute to one thing or another, right? Well, yeah, you have problems sleeping because there's a hormone issue, and your exaggerated startle response is often a sign of low magnesium levels. So we're probably deficient there. And there's always a way to explain it. But when you look at it, as you've been describing it, it does fit a lot of the people that I see, and I've just never put it together either before.
Yeah, I think this is really interesting. They've done studies on the physiology of people who are in PTSD, and they do show a lot of the characteristics that we see in people with chronic headaches. So first of all, for example, people tend to have low heart rate variability. Heart rate variability is a measure of kind of the balance of your autonomic nervous system. That's your fight or flight versus your rest and digest system. And people tend to be way over into fight or flight, which we see in headache patients all the time, partly because having headaches is very stressful on your body. The experience of pain by default puts you into fight or flight. And so, we may look at that low heart rate variability and say, oh, that's just the chronic headaches, but it can also be seen with PTSD. And another feature that we see in PTSD is that cortisol can be all over the place. Same as headaches. It depends on where you're at, right? After an acute stressor, your cortisol is high. Over time, it can sort of run out in what we call adrenal fatigue or HPA axis dysfunction. Kind of the newer lingo for it means the same thing though. And so this is part of the reason that the data on adrenal fatigue and migraine is all over the place, because people don't look at what part of that stress response they're in. Is it acute? Is it chronic? Like, the studies have not separated that out. So while the phenomenon is true, the data is lagging a little bit behind. But interesting, though, that we see some overlap with other physiological parameters that we find in people who have migraines in general.
Yeah, and one other theory that I wanted to kind of mention, because this is something that, again, I incorporated into my program because I've seen it multiple times. There's not great data supporting it as from a research standpoint, but when you hear the same stories over and over again from practitioners in the field that are actually doing this, there's got to be something to it. We just haven't figured out what that is yet. And that is that the theory that we can actually store negative emotions in the fascia that surrounds our muscles. So our muscles have a bundle of fibers around it that kind of help keep it in place. And that's called the myofascia, right? It's the tissue essentially that holds everything to the skin and the bones and all of that. And what can happen with this theory is that the fascia can actually store some of our negative emotions, the traumas that we've experienced over our life. And that can manifest in physical symptoms. And there is a very high correlation between chronic pain and traumas, as we've shared. And so one of the things that I hear over and over again, and I've read multiple stories, from people who have written about it online. I've spoken with multiple practitioners who practice either acupuncture or massage therapy that say the same exact thing. And I've experienced it personally where, I went in for a massage and the masseuse worked on a specific area of my body, my chest, specifically my pecs. And I burst into tears and I just started crying and I had no idea where it was coming from or what was going on. And she's like, it's totally normal. We store our emotions in our body. And, so she's just like, let it out. This is part of the therapeutic process. I was like, okay, but this is freaking me out. Like, I don't know what's going on right now. And I had a similar thing happen when I was back in med school and I did acupuncture for the first time. And I had such a rage release. I literally wanted to punch the student who was working in the face. Like, I wanted to go full on crazy on him. And it scared me to the point where I refused to do acupuncture for years afterwards, because I'm like, I don't want that happening again. So there's definitely something there to that theory that we can store some of that, in some of those, the anger and the, depression and the sadness and the frustration and the confusion. We can store those negative emotions in our body. And, if you've ever experienced something like that, you might not ever want to go back because, it's scary. It really is scary. But I would encourage you to, if that has happened, go back, explain what happened the first time. If you can remember the area of the body that was being worked on at the time, make sure you let them know that too. And, but that obviously is an area to work on to help release some of those emotions from the physical standpoint. That can, ultimately, when I finally worked through all of those stored emotions, I noticed a huge difference in my health. And this was actually fairly recently that the last episode happened. It was another release of I was mourning the loss of some loved ones that apparently I hadn't fully processed. And once that happened, it was night and day difference. I was sleeping much better. I had way less pain. And that was just a few years ago. So I think it's a very real thing that we just don't have the data to back up yet. But I think that sometime in the future, we probably will discover that there is something from a quantum theory kind of something that's showing that there is something between this, because, you know, like I said, it's happened. I've heard story after story after story of this happening.
Yeah. So I'm curious, you said stored in the tissues and it's the myofascia. So does that mean like tight muscles?
So when our fascia is tight, it actually squeezes down on the muscles, and yes, the muscles become tight as a result. And so, you know, I hear multiple times people go in for massage and it feels really good for the short term, but a massage for the muscles is different than a myofascial release massage. And so if a masseuse or a massage therapist is working on the deep tissue, that's the deep tissue massage, they're working on the muscles, they're not getting the fascia. And so it's really the fascial work that needs to happen. It's a much lighter, less satisfying, you know, massage. It doesn't hit all those awesome knots. But what happens is that once the fascia starts to become more pliable and loose, that will allow the muscle to move more freely. And then we stop seeing that chronic muscle tension. So the myofascial has to be addressed first, and then the deep tissue massages can come on afterwards. And it can be in the same session, but you really need to have someone who understands how to break down that fascia to really, truly get lasting results on the massage itself.
Wow, so interesting. I did not know that at all. I just assumed like the harder they press, the better.
I know, well,
Even
it
if
certainly
hurts.
feels better, that's for sure. But yeah, no, it's not always the case. Yeah.
Huh, interesting. And the last thing I wanted to talk about is another treatment for PTSD, which is called EMDR, eye movement desensitization. Oh my gosh, I forget what the R stands for, but anyway, EMDR. It involves using eye movements at the same time as you are desensitizing yourself to those memories. So, when you store a traumatic experience, it is very much linked to the emotional centers in your brain. When you remember 2 + 2 is 4, there's not much emotion there, right? It's stored in a very different part of your brain. It does not involve the emotional centers. But when there's something that really triggers that strong emotion in you, it is stored differently in your brain because it's linked to that emotion. Now, what you're trying to do with PTSD memories is detach them from those emotional centers of the brain, like the amygdala, for those of you who are neuroscience geeks out there like me. And we're trying to store them more in the part of the brains that remember things like 2 + 2, where there's not a lot of emotion associated with it. So the thinking is that you recall these experiences in the presence of a therapist who knows how to guide people through the process. And you have things you look at, either the therapist's 2 fingers and you look from one to the other, or a variety of other types of eye movements that you can do. And the thinking is that you're activating different structures in the brain, and you're basically rewiring your brain so that those memories are stored in a more neutral area. Now, this actually works really well. This is the #1 recommended treatment strategy for PTSD, according to the VA. And of course, they deal with a lot of PTSD in returning soldiers. And EMD therapy is fairly easy to access. You can just Google EMDR provider in my area and get plugged into something that really works. So if any of this has resonated for you and you feel like PTSD might be part of the underlying fabric of your migraines, I just want to encourage you that this is something that's treatable. Once you get it out of your system, similar to what Dr. P was saying, it's gone, it's released, and it's no longer there contributing to the headaches. And of course, we want to, get to that root cause of our headaches, no matter what they are. We will always want to be able to dig deeper, find those causes, find things we can control and fix them. So any last thoughts, Dr. P?
No, I think that that's a pretty good place to start. One thing that I will maybe end on is I've had, That's one of the screening questions that I ask any new client is, do you have a past history of trauma? Or, basically asking if there's something like this potentially in their life. And a lot of times they'll say, yes, but I've already dealt with it. And so I'll dig a little bit deeper and I'll ask them to talk about it. And I'd say 9 times out of 10, they're very uncomfortable. They still don't want to talk about it. They're very quick to say, oh, I've dealt with it already and I've moved on. And I don't really want to talk about it anymore. And while I can understand that, when you have spent a lot of time working through something that's traumatic, you don't want to dwell on it anymore. But at the same time, there's also that aversion, right? And if you can't talk about it, even though it's like, okay, I don't really want to tell this story again, but I will. I have a few of those trauma situations that I had to work through, and I don't really like talking about it per se, but it really doesn't bother me anymore. I can tell the story to anybody who wants to listen to it, where I can't say that was true even 2 or 3 years ago. So it's something to just check in with yourself. If it's something that you just don't really like talking about because it's just not something that you find enjoyable, that's one thing. But if you have negative feelings that come up when you think about it, or when somebody asks you about it and you get defensive or mad, or just like, leave me alone about it, there's something still there that hasn't been addressed fully. And so I like to encourage people to really pull that memory out, poke it around, feel it. If you feel like you've, dealt with it, you should be able to do that without having any problems. If you really don't want to do that and you're trying to avoid it, there's still something there. And so then we would encourage you to, go pursue that a little bit further.
Yeah. Really good point. Numbness and avoidance is part of the diagnostic criteria for PTSD. So those are very normal symptoms for people to be having, but you can't let that fool you.
Yep.
Yeah. All right, everybody. Hope that helps. Thank you so much for being here today, Dr. P. And
Absolutely.
thank you. Yeah, thank you so much, everybody, for watching. Both of us work on this issue in our programs. If you want any more information about how it works to get to the root causes of migraine, you can find that at migraineclass.com, migraineclass.com. We don't talk about PTSD specifically in that video, but it is something we address in the treatment programs, and that video does explain other root causes of headaches. And for you, Dr. P, how can people find out more about your work?
migrainemastery.org.
All right, awesome. Okay, thanks everybody. Bye.